So, September is PCOS awareness month, right? And there's been a lot of conversation, a lot of argument around PCOS in regards to hormonal imbalance, in regards to your diet, in regards to irregular menstruation. But then I would ask, is PCOS hereditary?
Good question, actually. So PCOS is still that part of medical science where there's still a lot of research going on, but they have actually found a strong genetic component to PCOS, not just like hereditary, like if your mother has it, a child must have it, but there's actually a connection. There are also some people who have PCOS that no parent actually has it, but they will have something else, connected to their genes that could be passed, and then it expresses itself as PCOS in a child. So there is actually a component for that.
So when you said something else connected to their genes, so most times you see mothers that have, say, the hairline, man-like hairy features, and then you also see it in their children. So is that the part of the hereditary thing, or the passing on thing you're talking about?
It's a possibility because, for example, if we talk about the hair, right, hirsutism, not every person who has hirsutism actually has PCOS, right? Okay. So there are some people who have that. It runs in the family, it's not a problem. Is it connected to PCOS? No. What would be connected to PCOS would be in the genes itself, which is also an area they're still investigating to, kind of isolate which particular gene is leading to people having PCOS. So things that are connected to hormones itself. For example, some parents, especially like grandparents, they may not have known what they had. Yeah. Sometimes people would have issues with periods and they just take it as it's just one of those things, but they don't know that it's actually connected to it. So some people may not actually have enough history in their family to know that, okay, it's connected to a parent or so. But like we see, PCOS is not only hormonal. There are some things that are connected to the endocrine system. For example, we're talking about insulin resistance. So when the body that's supposed to receive the glucose, for it to function well, for it to have the energy to do all of that, it's not receiving it. So insulin is not going in with the sugar, it's staying in the blood. That's making different parts of the body to begin to react in a way it's not supposed to. So that is the connection between the epigenetics we're looking at, and then that talks about the environment, talks about chemicals. So like there are a lot of factors that come together to constitute PCOS.
Okay, thank you so much. Very elaborate explanations. So I keep wondering, when we're growing up, like in the last 10 years, you don't hear these things. You don't hear them. They are very rare. Maybe people have them, we don't know. But then these are not too common then. So what has been the changes? Because I'm looking at what happened in the next 20, 30 years.
Yeah.
So what could be and what can be done in the future, generally on the large scale?
Well, for me, which is part of why I try to go into this, to really read what is the reason for all of these things. Like you said, our parents, grandparents, it was not really a thing to be said, especially here in Africa. It was not a big deal. But now it is so rampant that out of every, I don't want to make a random statistics, but it's quite common. So for me, what I've been able to pick up from the materials I've read and consultant gynecologists and obstetricians I've talked to, one of the major parts is our lifestyle. Our lifestyle has changed. We have a lot more chemicals in our food than they used to have in those days. Number 2, stress. The average Nigerian is stressed, like average. We're just stressed, right? So we're just leveling our stress and coping on different levels, but everybody is stressed. And the problem is not the stress. The problem is the lack of rest after the stress. So the body doesn't get to heal after a long time of stress. Now when it's not healing, it's not allowing for the body to deal with toxins. So the toxins are remaining in the body and it continues like that. Now once the genes begin to adapt, the hormones begin to change, the cells begin to change, all of these things are happening, then the next offspring is going to have 2 problems, right? So it's not accumulating. So that's why when you said 20, 30 years, I'm really scared. I'm really, really scared because if we're having this level now, what's going to happen to the next? Because more and more people are not eating the right things. Most of what we eat is for the tongue. If it tastes good, it's food. We just eat it. But a lot of those things are not food. Ultra processed food is a major factor to why PCOS, and not just PCOS, a lot of issues, medical conditions. Now it's even getting into mental health. PCOS too is even connected to mental health. PCOS is even connected to insomnia. People are not sleeping. So now, is it the sleep that is causing the PCOS, or the PCOS is causing the lack of the sleep? It's like the the hen and the chicken thing. Which one came first? The hen and how they put it? The chicken and the egg. Which one came first, right? So all of these things are constellation. But like I would always say, they are the red flags. Red, which means rest, exercise, and diet. A lot of that we're not doing. And if we're able to get back there and get back to the natural, healthy food, the way it was designed for us to eat, plants, that's why there's a lot of diet now. They're talking about Mediterranean diet. In fact, there are a lot of names to diets now as to what you can be able to do that can help PCOS, right? If we can go back to that, I think that's a big step to helping us, because if it's stress, I don't think we're going to stop that anytime.
Going back to diet usually because of the cost implication. Because if you go to the market and want to buy things like say cabbage, carrots, cucumbers, they're expensive.
They're not even pure.
So what's the variance that we can use and say, okay, since because you see that the foundation of this whole thing is our diet, right? One of the major things. If we now want to go back to this proper diet, it's expensive and most people cannot afford it. So most times we're just relying on this other one that is affordable and that can last for us.
Survival, just to fill the stomach.
Like my president said, we'll go back to farming. When you are building, create place for your garden and just farm your food, because even those things now there's the GMO thing, right? So even the vegetables, you're not even sure of what you're eating. So all of these things, plus the kind of fertilizers that are being used, they want things to grow fast and all of that. See, the thing is, whatever we're doing, we have to make the sacrifice. We have to go back, because there's no alternative. It's either we eat healthy or we deal with the consequences.
So the truth is that age, the age that is more prone to having this PCOS, what age range are more prone to having it?
It used to have an age, now it doesn't have an age. It doesn't have an age. I've seen people with 17, I've seen people with 15 already having PCOS. Some people with later it comes up. The thing is, like we said, right, it's a constellation of symptoms that are happening connected to not just periods themselves, the hormones, but as the lady grows, as it develops, it becomes more expressed. Yes. So some people it may get its expression later, some people very early.
Yeah. And so thanks to medicine, there's been we've seen a lot of PCOS and mothers give birth. We've seen a lot of people with PCOS be able to manage it, and that goes to like medication and healthy living, dieting the right way, right? But in the long run, is there a path where you keep taking those drugs and then PCOS is cured?
That's a tough one. Majorly because it's just like there are certain types or certain conditions, medical conditions that we're not able to follow through. You know, we're not in a time in those days where you can follow through someone's condition for the next maybe 8 years, 10 years, right? Most of what we do the first year, once a person gets that what they were looking for, they're gone. You don't see them again, right? So you're not able to follow through to know, okay, how effective is this treatment? Most of the medications that are being prescribed for those with PCOS is actually to achieve a goal. It's not really to cure it, because in the first place, it's not a disease, right? So they've not isolated, okay, this is what, if I deal with this, then everything is cleared. It's not really like that. So what we try to do, okay, what are we seeing the body is presenting with? If we see a person that is overweight, we try to work on that. We look at HbA1c to see if they're actually diabetic, and then they get on those anti-diabetic medications. But just like treating any diabetic, it's not just the medications. There's the lifestyle, there's everything that has to be put into place. So now when we're dealing with that one, when we notice that sugar is getting better, then the other symptoms also begin to get better. But sadly, a lot of people, once they start feeling better, that's it. You don't see them anymore. So we're not even able to tell. But at least let me just share this testimony we have with someone that I met 2 years ago. So when she came, she had been seeing her period only 3 times a year. Once, she would see a period, then maybe the next 4 months she sees again. It was like really, really bad for her. And she didn't even know it was PCOS. She just kept trying different things and wasn't getting any help. But the good thing for hers is she didn't have the endocrine part. Her sugar levels were fine. She was not overweight. The only problem was just the periods were not just coming. She didn't even have hirsutism. So it was difficult to actually say, okay, let's look at this. But when we did the test, We looked at testosterone, it was higher than it was supposed to. So what we did was just to help change the lifestyle. So from 2 years ago to this year, she's been having regular periods. I think she missed one so far from January because I tried to keep tabs with her. Now, those are patients that you can follow through. I don't know if we'll still continue, but hopefully that's someone that we can follow through to see. And one area that really helped her was we had to do a lot of work figuring out which food works for her. Because some of the foods that you would expect to work for her, it didn't work. So we had to keep trying different things, and that comes to when we talk about growth, nurture, and nature. So a person who grows in the north and a person who grows in the southwest, for example, is two different lifestyles. If I give the same treatment, it will not work for two of them. So we had to go back, and so that's where the where the thing is. But for cure, so far no. Yes.
Yeah, I think the final question from me would be: is it possible to have PCOS and just have one symptom?
Very possible. Very possible. Yes. So like this lady I told you about, so she didn't have the the weight gain, she didn't have the abnormal hair growth. Hers was just periods were not just coming at all. Then when we did the pelvic scan, we noticed that she had that the rosary bead, as they would call it, over multiple cysts in the ovary. So for her, that was just the major thing. She looks very good, takes care of herself and all of that. She hits the gym. But just that period was a problem. But when it comes to symptoms alone, that's why the diagnosis for PCOS is not just one thing, not just the symptoms. It's symptoms plus the hormonal profile plus the pelvic scan. So it should have at least two of those three to be a diagnosis. Yes.
Okay, thank you so much. I think that's all for now.
So what's your advice on diagnosis as for early detection and prevention? What's your general advice on being diagnosed early? What's the cost implications? What would you want to advise on being diagnosed as early as possible?
Yeah. So not everyone sees their menstrual cycle at the same time when they're starting menarche, right? I've seen quite a number of people who they start seeing their period from age of 9. Some people age 10, some people age 12. Now that's early, right? And different states, different countries have their different ages. But what I would suggest is because that first period, maybe the first year, second year, it may not be regular. For a lot of people may not have that regular. But if after the third, fourth, fifth year, that from the time you start seeing your period, it's still not regular, it's good.
Something is wrong.
I think I'll even have to cut you short here and tell the viewers to watch out for the Q&A coming up, where you would have the opportunity to ask all your questions. The details will be put out on this video. There will be a Q&A session where we'll ask all the questions that we want to ask concerning PCOS. So thank you, Doc, for this wonderful session. I look forward to the Q&A, so I can ask all the questions that I can.
Yes.
Thank you very much.